your hip flexors, you should be stretching them day after day, non-stop, until they just can't stretch anymore. And if you have hip pain, well, then you should never strengthen them. But are these beliefs true? Are these truisms as factual as we think they are? What happens if you actually try to strengthen your hip flexors if you have hip pain? Let's talk about all of it in this video, because the truth, well, it might be a little painful. So first, let's talk about where your hip flexors are. There are two muscles that are considered just primary hip flexors, but there are many that contribute to hip flexion and should be considered your hip flexors. But the two main ones are psoas and iliacus. They attach down here to your femur, and then they go up over the front of your pelvis. The psoas attaches to the front of your lower spine, believe it or not, and the iliacus attaches to the inside of the bowl of your pelvis. Those are the two primary hip flexors, and they help you do this. There are other ones that are all around the front of your hip. So those could be your quads. Those could be the glute minimus, glute medius, the TFL. There's just a bunch of muscles there. And even some of your adductor muscles assist in creating hip flexion. All of them should be thought of as hip flexors, but you don't need to get into the nitty-gritty details. You just need to know that to stretch them, you just have to put your femur back into hip extension, and that's going to tension those muscles. Was that good for you? Oh yeah. And before we get too far into this video, I want to ask you, what got you interested in this topic in the first place? Why are you thinking about strengthening your hip flexors or stretching them? What is your motivation? Is it hip pain, back pain, sports, something else? Drop me a comment down below. Now, when your hip flexors get really short, they can trap you in painful positions. You might feel like you are stuck in anterior pelvic tilt or hyperextension of your lower back, sometimes called hyperlordosis, and that can lead to back pain. It can also lead to hip pain and even knee pain. But does that mean you should never ever strengthen your hip flexors if you've got hip pain or back pain? Does that actually make sense? Should you really just keep stretching your hip flexors no matter what? When you have really short hip flexors in the front here, they get you trapped into anterior pelvic tilt and hyperlordosis, meaning your low back feels like it's getting crunched all the time and your hips feel just awful. Now, stretching your hip flexors can help. You're lengthening those muscles, which helps restore the bone position to something that's a little more relaxed and less likely to feel like things are being impinged upon. Now, I had a student of my Back Pain Fix program send an email and say, hey, I noticed that I'm supposed to do hip flexor strengthening, but because I have back pain and hip pain, I was told I should never do any strengthening of my hip flexors and just focus on my glutes because that's the root cause of my problem. It's a very common belief among personal trainers, physical therapists, chiropractors, you name it. Whatever kind of health professional you're seeing to help you with hip pain, it's very likely that they're going to tell you that you got to strengthen your glutes. Even I have been a firm believer, and still am a firm believer, in getting a firmer booty to keep your hip pain at bay. But not strengthening your hip flexors, that's a belief that I no longer adhere to. The thing is, for maximum comfort in your body, you want to make sure you have strength at every length for every muscle. You don't want to just strengthen muscles in one specific small range of motion, and you also don't want to just be lengthening muscles constantly and trying to get them to be weak and relaxed in that lengthened position. Instead, you want to be building strength at every piece of the range of motion so that you have strength at every length. Right now, I'm stretching out my chest muscles, I'm teaching them to lengthen, but then I'm also adding contractions to make sure that my muscles can work in that specific range, in that specific angle, so that I have strength and control in that range of motion, and that makes my shoulders, my chest, and everything feel a whole lot more comfortable, and I feel more confident. So let me show you a couple examples that illustrate very clearly why you need to strengthen your hip flexors even if you do have hip pain, and even if those hip flexors are kind of short and tight. And I'm going to show you a couple quick exercise examples, and at the end of all of this, I'm going to explain something about stretching that nobody else has bothered to tell you that will really help you get faster gains in your flexibility that help you feel safer and more comfortable in the long run. So imagine you walk with a limp like this. Your hip flexors actually don't really fire much, and yes, your glutes are pretty weak, because when you walk, instead of getting a normal stride where your femur is actually able to go into extension and also flexion, you're not using your extensors or your flexors at all, and instead everything's getting super stiff and tight all along this side of your core. And I think in this situation, it's not hard to see that your lower back might start to feel a little bit crappy. Now, in this situation, when your glutes and your hip flexors are super paralyzed, would you really say never ever strengthen your hip flexors? What if you want to be able to lift your leg up sometime in the future? What if you wanted to be able to do anything requiring hip flexion? If your hip flexor muscles are super weak, you're not going to be able to access any kind of hip flexion position. And if you can't flex your hips cleanly and comfortably, you're going to compromise at your spine, which is then going to lead to more back problems. And what if you're one of those super flexible people, not like me, who can just easily sit down into the front splits with no problem and feel no restriction whatsoever in your hip flexors, but then you still feel hip pain and back pain, and your hips feel loosey-goosey and unstable all the time? Would you really then say you should never strengthen your hip flexors? Strong hip flexors help you run and sprint. They help you step over roots on a trail. They help you avoid obstacles like children's toys in the yard or in the house. If you can't lift your leg up, you're gonna have a lot of trouble in daily life. They're important if you want to step onto some stairs. And they're definitely important if you want to step onto something that's even taller than a normal step. They're also important if you want to dance or jump or throw a kick. Hip flexors are helpful if you want to do some smooth, deep Asian squatting. And it is still true that weak glutes are a big contributor to hip pain, so you should definitely also make sure you train your glutes. It could be the case that your body needs a lot of glute training right now, and because you have limited time and energy, you should prioritize your glutes. But it's also possible that you might need some hip flexor strengthening. You might need some strengthening of your inner thigh muscles and your outer hips. It could be a lot of different muscles, so even if right now you're focusing on building up your booty, make sure that at some point you start to rotate your priorities and rotate the exercises you're doing so that you can train other muscles besides just your glutes. And if you're finding that strengthening your glutes is starting to make your hips unhappy and stiff, remember that you might also want to consider stretching your glute muscles with things like the pigeon stretch. I will link to a video in the description box down below. Just like your hip flexors, you need strength at every length. So now back to your hip flexors, we need to do some strengthening exercises, and luckily that doesn't have to be so complicated. You could just be standing and practice lifting your leg up and holding it as high up as you can for as long as you can. Or you could do it for repetitions, holding it for like 5 to 10 seconds at the top position. Or you could do it at the top position with the knees straight, and it's gonna feel horrible. Or you could just take a weight, it could be a dumbbell or an ankle weight, and build strength through as much of the range of motion as you can with that weight so that it doesn't just slip off. Heck, you could even use a band like this attached between two posts, and you could use that to provide the resistance that helps make your hip flexors stronger. You could lie down on the floor and use a cable machine to train your hip flexors through a nice big range of motion. You can lie on the end of a bench and work on building strength in your hip flexors in that really lengthened position while you're in hip extension. If you want more of a challenge, you take an ankle weight, throw it on there, and do the exact same exercise and really focus on building control and strength in hip extension, but really using those hip flexors so that they are stronger when they're long. I'm gonna throw some links in the description box so you have some more detailed explanations of all these different options for strengthening your hip flexors. If you're dealing with hip pain, remember that training your hips should be like a good conversation. you're exploring different areas and putting a little more emphasis on things that seem interesting and that resonate. Maybe this month it's your glutes and your hamstrings that you're really focusing on, but maybe next month you want to put more focus on the inner thighs and the hip flexors. Your priorities will change and you're going to just keep exploring different areas to see what feels interesting and what feels like it's productive for you in the conversation. And like any good conversation, you don't want to beat up the same point over and over and over again. So if you feel like, yeah, you know, I've trained my hip flexors a lot, I made progress, maybe I should switch to something else, go ahead and switch to something else for a while. Just remember that it is important to strengthen all the muscles around your hips at some point. Now I need to explain something to you about stretching that probably no one has ever said to you before. Think of your flexibility as being a function of your strength. In other words, the reason you can't get into certain positions is because your brain and your muscles are saying, hey, we just can't handle that. Now let me give you a really clear example. First, you need to see that my shoulders and my arms have the ability to go through this full range of motion very, very easily. If I add 10 pounds to this equation, I still have no limitation whatsoever in my range of motion. I can go up and down, I can stop at any point along the path, and it's no big deal. This is my start position, this is my end position, no problem, no flexibility issue. There's nothing stopping my range of motion here. But if we start to add load to the scenario, you can see how strength becomes super important for your range of motion. I never ever do the overhead press with a barbell, so I've gotten pretty weak with this. But currently, I can at least press this up overhead, and I can lower it down, but it's a bit more of a struggle. Now imagine if this weight were an extra 50 or 100 pounds and somebody placed this bar in my hands in the start position. Would I be able to lower this bar down safely through the full range of motion? Absolutely not. If this bar were much heavier, when I have it in my hands, assuming I can hold it up over here, if my brain and muscles can sense that they can't handle lowering this down safely, the furthest I can go is that lockout position. I'm gonna be stuck up here. I'll just be like, nope, nope, I'm not lowering that anymore. There's no way I can safely do it. Seriously though, there's no way I could safely do it. I don't train this ever. If your body knows it can't produce enough force to safely manage a given position or motion, your body just won't let you go there. That's why using load and contractions when you are doing stretching can be so effective and so crucial in getting more flexible and feeling safer and more comfortable and pain-free in all of your joints. So make sure you check the description box for a link to a video on how to stretch for flexibility. So going back to our original question, if you have hip pain or back pain, should you just never strengthen your hip flexors? The answer, in my opinion, is a resounding no. Make sure that you are exploring and experimenting, stretching and strengthening muscles all around your hips, your back, your shoulders, everything to help get your body ready for all of the different challenges that life might throw your way. And if you have hip pain and you'd like a comprehensive program to help you rebuild your hips, go to uprighthealth.com/HH and check out my Healthy Hips program. It'll show you how to stretch, massage, and strengthen your hip muscles so that everything feels better, so that everyday life can be a whole lot more fun and a whole lot less painful. You can check out that program for 60 days and still get your money back if it doesn't feel like it's a good fit for you, which is pretty awesome. And when you use my Healthy Hips program, you're actually supporting more free content like this that I post here on YouTube. Speaking of free content, you can also get a free preview of the workouts in the Healthy Hips program, and you'll get other free workouts to help you rebuild your posture and your shoulders and your back and your sleep if you check out the Body Rebuilding Basics program, which is at uprighthealth.com/BRB. So even if you don't have hip pain, or you do, you should still get that free program. It's pretty awesome and it's gonna help you. I've also got a couple free videos that I think are gonna help you here on YouTube. I'll post them right here. Like, share, and subscribe. And as always, I hope you remember that pain sucks, life shouldn't.